2-minute pathologies. So we're covering salivary gland tumors. So today we'll be covering pleomorphic adenoma. Pleomorphic adenomas are the most common salivary gland tumors. So they are about 60% of all the salivary gland tumors happening there on the parotid gland. They're also known as mixed salivary tumors. They are the most common benign tumor of the salivary gland. It happens in 30 to 50 years, more common in females than males. So, what is the etiology? So, it's the radiation exposure which increases the risk of this pleomorphic adenomas. So, what is the etiopathogenesis or genetics which tend to make this pleomorphic adenomas? It is the overexpression of the PLAG1 gene and the mutation of the HMGA2 gene. So, that's very important. Coming to the morphology, which is very often asked. So, the morphology, before the morphology, I would like to tell you something. It happens majority in the parotid gland, most of like 60% of the time. So, the superficial lobe is around 60%. So, the parotid gland is first, then comes the submandibular gland, then comes the sublingual gland. Coming to the gross morphology, gross and microscopy. In the gross, it's very simple. It is solitary, 2 to 5 centimeter in diameter, circumscribed, pseudo-encapsulated. It's a well-demarcated mass. Its 6 centimeter capsule is pleomorphic and was not fully developed. Protrusion into the surrounding gland is seen. Cut surface shows gray-white with myxoid and blue translucent areas of the chondroid, which is cartilage-like stroma. Coming to the microscopy, which is very important. In the microscopy, you see, so this is the gross of this. Coming to the microscopy, you can see the epithelial elements and the mesenchymal elements in the pleomorphic adenomas. It's also called the mixed type of the adenoma. Epithelial, you see the ducts, acini, sheets, strands, and cuboidal and myoepithelial cells. Mesenchymal elements, pseudocartilage, which is matrix of myxoid, chondroid, and mucoid material. So that's what the microscopy. As you can see here, pleomorphically, it's bluish myxoid type of the chondromyxoid matrix. So that is important.